Welcome to AXREM Insights, developing healthcare through MedTech and innovation. Join Melanie Johnson and Sally Edgington as they talk with our industry leaders and experts.
Hello, I'm Melanie Johnson and I'm here with Sally Edgington. Today we have the pleasure to be speaking to David Lawson, Director of Medical Technology at the Department of Health and Social Care. Welcome, David. Thank you for being on the show and allowing us to get to know you a little better. With our podcast theme being collaborations, I will start by handing over to you to tell us a little bit about yourself.
Yeah, I'll maybe just give some background in terms of my career, perhaps. So my first job was in Leeds, and I joined probably the lowest possible rung of the ladder as a casual admin assistant back in 1997. So that was in the commercial team of the benefits agency. And then from there, I kind of moved into London back in 1999 into a procurement policy role before joining Guys and Tommy's in 2001. And I think after a couple of months, I was made head of procurement. And I think at 24, I think I was one of the youngest procurement heads in the NHS, but within one of the largest trusts in the country. At the time, the team was pretty small, it was about 20 people, and all the systems were kind of paper-based. So you had a process of paper requisitions being posted to the procurement team and then manually entered into a system. And the biggest innovation at that time was the auto fax machine that faxed those purchase orders over to suppliers. 21 years later, that team had expanded to over 150 people, and we created a kind of shared service supporting some other trusts in London as well. And then in 2022, I moved to Big School and joined the department to lead the MedTech policy team. So I've spent my whole career, I guess, in the public sector, initially in the civil service, but then most of the time in kind of NHS land. And now I'm into Big School.
And so for anyone in the NHS that thinks it's still a bit old school with their IT systems, you can tell them very differently with faxing. And I'm sure there were, obviously the pages and all the other things that are a bit more old school. So David, I know obviously we speak quite frequently that one of your key focuses in the last year has been the MedTech strategy. Can you tell our listeners a bit more about the strategy and what progress has been made and what your kind of key focuses will be for the next few months?
Yeah, sure. So the MedTech strategy was published in February last year, and it was the government's first ever strategy, I think, on medical technology. At its core was, I guess, this vision of achieving right products at the right price in the right place. And I guess within that context, that one of the key challenges that we're trying to solve is that with medical technology, it's just that sheer range and choice of technology available. So for every one medicine, I think, used in the NHS, you have 33 medical devices as a comparator.
Wow.
So to address this, we've been focusing very much on trying to build the kind of data infrastructure needed to help identify and ensure the most effective technology is adopted. So the foundation of that work has been to establish a national product information management system, a PIM, to provide that single version of truth. So we've completed the alpha phase of that PIM where we've built a prototype, and now next step is to kind of move ahead into having a beta phase, initially a private and then into a public release late next year. And I think in parallel also, we've been working closely with NHS Supply Chain, and they've created a national asset tracking system as well to improve visibility. And I think that now holds over 600,000 assets. So going forward, that information will really help inform decision-making on equipment renewal. But in parallel to that, also been trying to look at the kind of pathways to adoption. So working closely with colleagues at MHRA, NICE and NHS England. So in October last year, we launched the Innovative Devices Access Pathway, IDAP, to provide joined-up support across MHRA, NICE and NHSE for 8 novel technologies that meet an unmet need. And in May, NHS England and NICE also launched a public consultation on a rules-based pathway to provide automatic funding for up to 5 selected technologies each year. But alongside that, I guess the strategy also touched on supply resilience as well. So we've been developing a program to encourage a move towards, I guess, a circular economy, so reusable and remanufactured devices. The program's called Design for Life, and the roadmap is due to be formally published this month. So we're quite excited as a team to get that out. I guess looking into the kind of future over the next 6 months, one of the things that we're seeing as a kind of key priority is to progress work on building a value-based procurement methodology, and also a supporting digital system that for now we're calling the MedTech Compass. And this is very much about trying to enable similar products to be displayed side by side and to provide a kind of passporting system for suppliers to be able to validate their products in terms of the evidence claims. And I think this is crucial given that, for medical technology, 90% plus of tech is purchased at a local level. So we see a real need for a kind of standardized methodology and a supporting digital system to kind of support adoption of innovation. And I guess as a first step on the Compass, we're launching a discovery phase later this month. So we will be reaching out to you, to industry, to kind of really get involved to help shape that design. So the MedTech strategy, very much alive. Lots of initiatives kind of underway, kind of in parallel with each other. But I guess at its core, it's trying to improve kind of basic visibility, to improve decision making around tech, given that challenge of so much choice that's available.
Yeah, and we're very supportive of AXREM, of the strategy, and sort of feeding back on some of the things you said. Data has to be key to decision making, right? Because having that data, and a lot of our companies have a lot of data, so it's only right the Department of Health and the NHS have the data in order to make those informed decisions. I also think that we need to make the UK an attractive place for industry to come. So I think there's obviously a lot going on with regulations and, obviously with Brexit and all the other things. And I think that we just need to, get some clarity on all those things, which, we speak about in a lot of the meetings that we're on. But I absolutely think we just need to make sure that we attract the right companies with the right technology. So obviously patients are getting the right, treatment and the products that offer that treatment. Just one thing that I wanted to touch on was the Lord Darcy report was published recently. How do you think your strategy can help deliver reform?
Yeah, I mean, Lord Darcy's report, I think, is a bit of a moment. I guess it's kind of it's like bringing out all the skeletons to say, how bad things are in terms of the NHS. I guess from my perspective, medical technology is without doubt seen as a key kind of enabler for change, an enabler for, I guess I'll call it kind of system service transformation. The government's has set out a set of kind of missions. One of them is a health mission. And if you hear the Secretary of State, he'll talk about, 3 big shifts in healthcare. So analog to digital, treatment to prevention, and hospital to home. And we have to rehearse these 3 shifts every morning before we brush our teeth. We have to repeat these 3 shifts so that we memorize them each day. But MedTech has a key role really to help deliver on that ambition and that shift in how healthcare is provided. So I think in terms of where MedTech fits, I think the key next step is to see how it fits within the 10-year plan, which is due to be launched next spring. I guess from my perspective, the positive is that there is going to be a working group focused on life sciences and MedTech as part of kind of building off the Darcy report and then feeding into that 10-year plan. So there's a recognition of the role of medical technology. I think the challenge, though, that the MedTech strategy is trying to answer remains the same. How do we, as a system, select those technologies that will make the biggest impact? And it goes back to the work we're doing about trying to improve the data infrastructure and also try to kind of sort out the kind of plumbing in terms of those pathways and that clarity. So to deliver against the health missions, we do need to still sort out the kind of challenges that the MedTech strategy identified last year.
Yeah, I totally agree. And I think one thing that I'm seeing over the last few weeks with the new government is that they are talking long term. So they're not just talking about their term, they're talking long term. And that's what we want to see, long term strategic funding, so that the right things are being funded and it's being planned long term. So I really welcome that. And I'm sure that feeds into the strategy and the 10-year plan. So that's all great.
So how do you think AXREM's members' innovation and technologies can help healthcare professionals of the future? And how do these technologies impact the workforce within the NHS?
I guess in many ways, it's almost like the same answer to the last question in the sense that it's clear that medical technology can be a key enabler and is vital, really, and essential to be able to kind of unlock the kind of future kind of healthcare system that we need. So the first thing is, which is a positive, is that I think there's a recognition politically that MedTech has a role. What we need to do now, though, is identify what are those technologies that can make that biggest impact, and how do we kind of secure that kind of long-term funding, and so there's certainty both for the health system in terms of knowing what technology to adopt, but also certainty for industry to know what we're needing as a system in order to deliver those free shifts in care that I talked about earlier.
And yeah, with the government seeing the life science sector as part of the economic growth of the country, which we've heard a lot over the last month or two, what can we expect to see over the coming months and years from the Department of Health to enable our sector to grow?
I think quite a lot. Again, if you hear Secretary of State talk, he frequently refers to the department as not just being a department for health care, but also he talks about the department being a department for economic development. So there's an expectation that in terms of the work that we do and the initiatives that the department take forward, that there needs to be a lens seeing how that will support growth. And obviously the life science sector offers a kind of double benefit, so both by providing tech that can help improve health outcomes, get people back to work quicker. That's one benefit, but the other benefit is, well, if there's jobs around the country being created by the life science sector, that's like a double boost. And I think at a political level, ministers are very conscious of the potential ability that if we can have a thriving life science sector, then that can create jobs, around the country, throughout the country. And I mean, I know from my own experience, I met with a supplier last month who got funding from the Welsh government, and they now employ 200 people in a town in Wales. And the average wage of that company is by far higher than the average wage of the town that they sit in. So so life sciences have got this kind of double benefit of both helping get the population healthier, but also by employing people on relatively well-paid salaries. There's two obvious opportunities there, I think, in terms of where I can see the kind of department, and particularly around MedTech, supporting this kind of aspect. So one is how we make sure that we calibrate the updates of the medical devices regulations. That should give clarity to industry in order to give the confidence to invest in the UK. And I think the second part is around clarity on the reimbursement and the kind of procurement processes that we use, again, to give confidence to industry. What I find is that particularly for startups, what startups need most is someone to buy their product. So we can sort out the kind of processes that we follow to give greater certainty to industry about how their product could be purchased. And that makes it easier for those companies to maintain kind of financing because it takes a long time to develop products and it's quite expensive. And ultimately, it provides a more sustainable environment where products are routinely purchased. So I think the big thing you'll see there is the department consciously thinking about, well, how will this particular policy, as well as helping healthcare, how is it going to help growth as well?
And it's really refreshing to hear the way the government are speaking about this. So it'll be great to see how that's going to kind of roll out in terms of our sector being such an important part of the economic growth of the country. And I absolutely wholeheartedly agree with your comments around MDR and, giving companies confidence to invest in continue investing in startups and SMEs, etc. So that's really good. I know that AXREM and myself have great engagement with yourself and your colleagues at the Department of Health. So what benefits do you get from engaging with trade associations, and how do you think we can continue to add value to the department?
I was going to say no benefit, but I probably won't be allowed back if I say that. So, two main benefits, honestly. So, firstly, I guess, is just the opportunity to sanity check and genuinely co-design some of the policy work we're doing. So, I mentioned earlier about we're about to launch a kind of discovery phase for this Compass tool. Part of that is to understand how a passporting principle could operate. That's something that industry have called for, to kind of make it easier to present their products, their technology to individual trusts and have a level of validation. So really valuable to get early input into those type of concepts to make sure that they're well grounded and well thought through. I guess the second opportunity would be, in the nicest possible way, to have our ankles bitten on kind of current pain points. So, that they're on our radar, and because don't assume we necessarily know about them all. So I guess the recent example would be the issue that you raised around credentialing. Yeah. I was aware of that from my previous role at Guy's when it first developed, but if I'm honest, it wasn't necessarily something on our radar more recently. But you wrote in, we're now picking that up as an issue. We've committed to kind of try and explore what the practical options are and present advice back up to ministers. So that's the other benefit as well, is to keep us honest, I guess, keep our ankles bitten on pain points, so we can be proactive and try and do something to improve things.
And I really welcome that two-way communication, which it really is, between your team and the trade associations. And obviously, we're able to give you that kind of industry operational perspective to the policymakers, because they may not see the perspective, and you don't want to be implementing a policy that could cause a massive issue to companies, and also, like with credentialing, a huge cost, which ultimately, if they do have to absorb those costs, that will go on the bottom line of products and services into the NHS. When, I'm sure as a taxpayer, you'd be the same as me. I want it to go on the patient care and not on, kind of bureaucracy and other kind of policies. So we just need to, have sensible thinking. But it is a great two-way communication. So thank you very much for that.
Right, so now a bit of a shift. So on to my quirky question. If you could hang around with any famous person, dead or alive, who would it be and why?
Crikey. Has to be Taylor Swift, I think.
We've got a Taylor fan.
I was not expecting that, David. Please elaborate.
Well, half my team seem to be devout Swifties. So I think if I was able to hang around with Taylor Swift, they'll end up being in total meltdown. Someone in my team even has a cardboard cutout of Taylor Swift, which makes some Teams calls quite surreal. So yeah, Taylor Swift.
So that would make you very popular within your team then. You'd kind of be the go-to if you were kind of friends with Taylor Swift.
I would be I'll be, although probably they'll be quite jealous, actually, because they want to be spending the time.
So do you actually a Swiftie fan yourself? You like the music and stuff? No.
Just to get one up on the team.
Yeah, just to get one up on the team. My wife, though, is kind of semi-obsessed with country music as well. So I'm the designated driver often on a weekend to go to various kind of random folk festivals around the country. So and I then get told off for kind of reading the paper when they're playing the music, which apparently isn't a done thing.
Oh, thank you so much, David, for your time today and for joining us. We found out loads more about you and the brilliant work that you're doing at the Department of Health. So thanks again, and thanks to all our listeners.
Join Sally and I next week when we will be speaking to MP Tim Farron. If you have enjoyed today's podcast, don't forget to hit subscribe or feel free to share the podcast with friends.